Okay, hello everyone. Welcome to the BCIT Digital Health Information Session. My name is Erin Ruggieri, and I am one of the marketing coordinators with BCIT Health Sciences. So thank you for joining us this evening. So before we get started, I just wanted to acknowledge that the BCIT campuses are located on the unceded traditional territories of the Coast Salish peoples, including the territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I'm actually working from home this evening, so I'm coming from the territory of the Coquitlam Nation. So if you could all also take a moment to acknowledge the territories that you're coming from. I know we might be spread out across the different areas of the province or even the country. Our agenda this evening is the welcome and introductions. That's what I'm doing right now. It says poll, but we will actually be skipping the poll because we realized that in our transition from Zoom, which we used to use, to Teams, polls don't seem to be working very well on Teams, so we're going to skip that. And then we'll have a presentation and program overview, some information about program advising, and then some time for Q&A. So as we go along, and as our program head Glinda shares this evening, you are welcome to type any questions you have into the chat if you can see the chat function. You may also hold questions for the end of the session, and we may have a chance to kind of unmute ourselves and take turns asking our questions then as well. Please do, though, stay muted through the duration of the presentation until the Q&A section, just so that we don't have any interference issues or anything in the background that's distracting. Okay, and I think that's all for me. Glinda, on to you.
Great, thanks, Erin, and good evening, everybody. Thank you for joining us today. I'm Glinda Reese. I'm the program head for the Digital Health Advanced Certificate Program. And this evening, we're just going to give you a bit of an overview. And as Erin said, at the end, we'll have lots of opportunity for questions, but feel free to put questions in the chat as well if you would like to. So we're going to start off with what is digital health. And as you kind of consider this program, you will learn that there are many, many different definitions for digital health. It does also encompass health informatics and clinical informatics, which are other areas that some of our students are working in or working towards. I like this definition personally because it really speaks to the fact that this is not about the technology, it's about the people that are working with the technology and how we can best support the teams that are working with the technologies to really look at how these devices and services can transform and optimize care delivery. And this definition is from Anne Snowden. She is out at the University of Windsor in Canada. We refer to this definition a fair bit. So why would you be interested in digital health? So you can likely appreciate that as time is moving, we're advancing digitally and technologically in the world, and especially in healthcare. And it is an emerging but rapidly evolving field. Generative AI has definitely moved things along even more quickly in the last little while. But we do need health professionals, and especially people who either are from clinical backgrounds or working in the healthcare system, who have an understanding of how healthcare works and can help bring the patient voice and the clinician voice to the technologists and computer science people who are working behind the scenes to develop and optimize these technologies. And as you can also appreciate, we have a healthcare crisis currently, and we are looking at how we can be creative about using technology to move or to improve the situation for clinicians and the human health resource challenges that we currently have. So the program has been developed. It is fully online, except for we have a capstone project at the end, but all 7 of the courses are online. They're not self-paced, but they are mostly asynchronous sessions with some synchronous sessions that we have on weekday evenings, usually from 6:30 to 8:30 p.m. We probably have 3 or 4 of those classes each term that are synchronous, but we do record them because we appreciate that everybody has busy lives and it's not always possible to attend all the sessions. We have a capstone project. Oh, sorry, just to go back. These courses can be completed in 1 year, all 8 of them, including the capstone. If you are wanting to do that, it is a fair amount of work, but it is doable, or you can spread them out over up to 5 years. The capstone project is completed in the final term, and it is basically an opportunity for students to bring the knowledge and skills that they've learned in the program to a mini project within a bigger project, and in an industry site, whether it's a health authority or a private setting, and to kind of have that opportunity to work as part of a team, and to learn from that team as well. And as I said, 1 to 5 years is the time for completion. So if you are working in the healthcare system, you're interested in this field of digital health or informatics, then this is a good program for you. If you're wanting to know and sort of work with teams to improve and optimize technologies and the digitalization of healthcare, then this is a good program. And if you want to make a difference and you see that there may be some opportunities for using technology to improve the current status, then also good place for you to be. And we are asking that you have a background in healthcare, interest in technology, and the desire to make a difference. These are very broad statements, but essentially you're by the end of this, you will have gained knowledge and skills around standards, terminology, interoperability, connected care across systems, the use and management of data and outcomes, and we also thread change leadership and project management throughout all the courses. This is the program map. Now, you don't have to do these all in the specific order, but we do ask that you do the foundations course before you do the other courses, and you do the data fundamentals course before you do the data analytics course. And we've organized them in sort of 3 groups or clusters. These first 3 under term 1 are, foundational. There's a lot around theories, principles, frameworks in these courses. The second set of courses are around the sort of application of everything that you've learned in the first term into practice. We do that in the second term. And then the third term is the capstone project, and ideally it aligns really well with a pre-existing course that we have in our healthcare management program around project leadership in healthcare. And then you can spread that out over 5 years, or you can do that all in 1 year as well. And this is our approach, which I've spoken to a little bit. We really focus on being learner-directed, where students are bringing case studies from work, facilitating and directing online discussions. We really try to kind of bring an equity-oriented approach to the whole program, very team-based. We have lots of cross-learning across disciplines and professions, and also within sort of healthcare authorities and different sites. There's lots of learning that happens across the discussions that we have. As I said, change leadership and project management are throughout, and we try to be as flexible as we can with what we offer in terms of courses and workload and expectations. And we also use a case-based interdisciplinary approach where, because this is such a quickly and rapidly evolving field, it's not like teaching anatomy and physiology. We really need to try and focus on keeping up to date and being current. And so by using case studies, we're able to do that as best we can for our students. Okay, and I think this is when I hand it back to you, Erin.
Okay, thank you, Glinda. So I hope that answered some of your questions you might have. And now we're going to talk about the entrance requirements. So if you want to take the digital health program, what do? So we do have some academic entrance requirements. And, I should turn my camera on. There I am. We do have some entrance requirements that are academic. So first off, we do require that you have 2 years of education in English in an English-speaking country with either English Studies 12 with at least a B, 73%, or you have 3 credits of post-secondary English, humanities, or social sciences from a recognized institution. And then for post-secondary education, we are looking for students that have a diploma, degree, or some equivalent accredited program in a healthcare discipline. So we do have an alternate option if you have a diploma, associate degree, or bachelor's degree in another discipline that's from BCIT or another recognized institution, and then some experience in healthcare. So either you have the education in healthcare or you have education and experience in healthcare. And we also require that our applicants complete a pre-entry assessment form. So that is on our website, and you can download that form from there, and you fill it out and submit that to digitalhealth@bcit.ca. And once we receive that, we'll take a look at it, kind of go over it. We might contact you to discuss any questions we have about your experiences or how this program would fit for you. We're really just making sure we have students who are kind of the right fit and this is the right situation for them. And once we sign off on that, you just include that signed form with your online application. Program details. So we do run at BCIT, we run 3 terms a year. We run our winter term, spring term, and fall term, as you can see from the screen there. Application period, there's no open and close dates for this program like there are for some of our other programs. This application period is year-round. So whenever you apply, you would start at the beginning of the next term following your acceptance. So if you apply in July or accepted in August, you could start in September. Linda did mention that the programs can be taken at different speeds, I guess. You could take 3 courses at once, or you could take 1 course at a time. So you can take this program in 1 year, but the maximum time to complete the program would be 5 years. So we don't want to have anyone taking longer than 5 years because of recency issues. So as I mentioned, some of the application steps already, you fill in the pre-assessment form, and convert all your documents to PDF, and everything is applied online. Now I do say apply online at bcit.ca here, but we are in the process of migrating to Education Planner BC. And if you haven't been in high school recently, you might not be familiar with Education Planner, but that is kind of the portal through which all post-secondaries in BC now are doing their application system. So you can go to that website, sign up for a username on that website, and it's really easy to do applications. Now you just kind of click on which institute you want to apply to, click on the program, and it's all kind of on one website. But if you go to bcit.ca and go to our digital health website, and click apply now, it'll reroute you right to that website. So it's not too complicated at all. It's always tricky you learning something for the first time, but once you've got it, it's a great system. So I'm quite happy about it. So on our end, once we receive your application, we go through and make sure you meet all the entrance requirements. Our admissions department forwards those applications back over to Glinda. And then we send out acceptance letters, and then there is a commitment fee that you need to pay once you are accepted into a program. I believe it's like $500. Is that right, Glinda? That's what I'm remembering, but I need to check on that. Now, moving away from the academic side, BCIT likes to support all of our students, whether they're in person or distance or online. So BCIT is really committed to supporting students in a holistic sense. So I wanted to let you know about some of the services for success that we have here at BCIT. One of them being our Indigenous services. So if you are Indigenous, BCIT's Indigenous Initiatives Department is there for you to ensure a smooth transition into your first year. They offer peer-to-peer mentorship, welcoming gathering place, and provide information and clarification on Indigenous funding. For financial aid, our BCIT awards, scholarship, and bursaries are all listed on our financial aid and awards website. We do have a President's Entrance Award that I would urge people to check out that you guys might be eligible for. Awards are always great to have assistance. Also, with accessibility services, BCIT is committed to providing assistance to students with permanent or temporary disabilities. So if you've been accepted into a program and believe you might need an accommodation to be successful, then you can contact our accessibility services department and they can work with you. And BCIT Student Health Services, which is one of my favorites. I love that we have this here. It's a health clinic located at the Burnaby campus. We have medical care available to students year-round. There's doctors on staff and nurses on staff, And it's great if you have difficulty getting into your GP, or there's a long wait and you just need something quick and simple, or you need a referral to somebody. Student Health Services is available for any current BCIT student. We also have a counseling and student development area, again, free for BCIT students, and direct services, a full service gym, free for BCIT students as well. Program advising. If you have any questions after this session about programs or about your transcripts and whether things translate or whether you have the English requirement necessary, you can contact our program advising department. They're available online, in person, email, telephone, and their hours do change, especially this time of year as we head into summer. So I would advise you to check out their website at bcit.ca/advising before you contact them. And now that you know a bit about BCIT Digital Health, we would love it if you kept in touch with BCIT Health Sciences in general. BCIT Health Sciences we're on Facebook, X, Instagram, YouTube, TikTok, LinkedIn, and we love sharing content about what our faculty are up to, what students are up to, what's going on in our classrooms and our labs, what students are learning. And it's kind of a great way to kind of connect with BCIT and find out what we're all about. And we'd love to hear from you on one of those platforms. Other ways to learn more about BCIT, big info sessions like this one. If you're interested in any other programs, you're welcome to check those out as well. And now I'm going to move to some questions and answers. And I see that we have one question in the chat. And Glinda, I'm hoping you can answer this. Glinda, what's the program cost? What's the program cost?
Great question. So each of the courses right now, so each course is worth 3 credits. Each course is around about $950. And so if you times that by 8 and also include, we just have 2 textbooks that we ask you to purchase, we're at about 7,800. So if you kind of bank on 8,000, I guess, for the whole program would be about right. Those prices might go up a little bit in the fall, but it should be more or less around that kind of cost.
And I see that someone's typing a question. Oh, if we don't live in BC, do we still apply through the education portal? Yes, you do, Jane. It's just something that BC institutes use, but it's not limited to where you live. Does anyone else have any questions? You're welcome to, now would be a great time if you want to unmute yourself and ask a question. You're welcome to do that as well. Does this program give you a certificate or diploma, Glinda?
So it's an advanced certificate under the BCIT credentials, and yeah, you get an advanced certificate. So it's not quite either of those.
Okay, I'm just waiting to see if anyone else types something in. In the meantime, I'm going to show this slide. This is our digital health webpage and our digital health email address. So you are welcome after the session. I know sometimes you think of questions later or you don't want to ask questions in a group format. You're welcome to email us at either of these email addresses to ask any of your questions. Some of your information that you might be able to find would also be available on our webpage. Oh, and Glinda's added something that she'd probably like to tell us about.
Sorry, I didn't mean to interrupt you. No, often students will ask this question is where, what can you do once you completed the program? And the link I've put in there is Digital Health Canada has a career matrix that outlines all this, well, not all, it's not an exhaustive list, but many of the roles and positions that fall under digital health in the healthcare system. And that will give you an idea of what kind of opportunities might exist for you once you finish the program. Or even during, like lots of our students have had been hired into some of these roles just by the mere fact of being in the program.
Glinda, I'm trying to think of any of the other frequently asked questions we've had in other info sessions.
Yeah, I think the something that comes up that I think I mentioned, if I remember correctly, is when are the actual classes? And yeah, they're in the evenings, 6:30 to 8:30 weekdays, and we do record everything. And we do try to sort of meet students where they're at in terms of that work-life balance. All our faculty also either have worked or are working in informatics roles or digital health roles. So you get some nice experience. And then the capstone project is also an opportunity for networking and it's sort of a stepping stone into the world of digital health as well.
And do you have to be a BC resident to take this program?
No, we have lots of people across BC and some international students as well. Well, some people who are here and then they go away, but they still, they go back and forth taking programs, taking courses. So you don't have to be here, except for the capstone. It would be nice if you can at least, do a sort of hybrid version so that you do, have that opportunity to meet some of the team that you're working with in person. But not critical. And we do, with the capstone project, we help you, we kind of connect with you prior to you doing it to try and find something that makes sense for you, that you're interested in, an area that you're interested in working in. And if you're not in BC, then we work with you and wherever you're at as well, whether it's in Canada or outside, to find something that will work with you as well.
Anyone else want to ask a question? Oh. Good question, Jamie. What advantage does this program at BCIT offer versus other programs out there?
So I would say, I think BCIT, we're quite focused on the sort of applied piece of this. So we do some theory because you need a theoretical foundation, but especially in the sort of second group of courses where, we do our best to at least get you practice ready or job ready so that when you do move into some of these roles that you would be able to sort of hit the ground running. I think the flexibility is also something that we do, and then the staying up to date. So we're always revising and moving, and we try to be as agile as possible with the content that we share with you and the discussions that we have, and we're kind of continuously updating and staying kind of in the know as to what is happening in the field at this time. I don't know what other advantages that I can think of right off the bat, but
those are 3 good ones.
Yeah.
Tamara is asking a question as well. If we need assistance or clarification with our coursework, how available are the instructors?
I think we're pretty available. We have a sort of 24-hour to 48 hours if it's the weekend turnaround, and we all meet with you, individually if you need to. We're, some of us will give you cell phone numbers, otherwise email. We try to. I think that would actually be another advantage, I would say, from BCITs, that we work with you. And alongside you, we're all learning together, and we're all adult learners. We don't have a sort of, this is the only expert in the room. We're all learning from each other, and one of the strengths that have come from the program is that cross-learning from the students, and the feedback that we got from students is that they really value the learning in their teams and groups, where they're kind of seeing what other people are doing in other health authorities and at other provinces or territories. So that's been really a strength as well. But yeah, I would say we're quite available. And courses transferable to other institutions. So if it's at the same level, there's a BC transfer guide where we can look at what would be required in your in the course that you're looking at. We have quite a few students who are maybe doing a master's and need an elective program with us, and then they do that back and forth. The University of Victoria has a master's in health informatics, which we don't get credit for any of our courses because it's a different level, but it does give you that competitive edge because they have quite a competitive entry into their program. And so students who are in our program, they will sort of give you that a little bit of a preference isn't the wrong word, but you get that competitive edge because you've done something in the space and you're able to sort of go into the masters with at least some foundational knowledge. Does that answer that question, Jamie, or is that okay? Good. And what we do with all students is if you fill in the pre-admission form, which is on the digital health website, it comes directly to me, and then I just sort of read through it and make sure that you're at least meeting the requirements. If you're not meeting the requirements, I get back to you regardless, and really just try and set up a meeting to have a conversation about kind of what your interests are, what you're in, make sure that this is the right fit for you. So if you still have outstanding questions after this, please do, if you fill in the form, or if you want to just email me directly, that's fine too, and we can just jump on a call and have a conversation about sort of what your questions are or anything that's outstanding after tonight.
Wonderful. Thank you, Glinda. I do have to back up Glinda here. She's very approachable, and we definitely love to chat with people. The question about how available are instructors, I would say BCIT instructors tend to be more available than ones I've dealt with in other institutes in the past. And yeah, we are all on the same learning journey together. So we don't want to create too much things about professors' office hours and things like that. We're not hierarchical here.
Mm.
Okay. Well, if there are no more questions, I think I'm going to close it off there. So again, you will be receiving a recording or a link to the recording of this session and a copy of the slide deck in about a week or so. It does take us some time to kind of download it all and clean it up a little bit before we send it out to everybody. But we really appreciate all of you coming this evening and taking some time out of your busy schedules to meet with us. So thank you.
Thanks, everyone.